Good evening, you're watching The Big Story, where we discuss the hottest topics of the day. I'm Olivia Quay, coming to you live from the Straits Times newsroom. Now, the number of coronavirus cases in Singapore has risen to 45, with 2 new cases confirmed yesterday. One is a 37-year-old Singaporean man who works at Straits Cisco. He was on duty at Chingay on January 31st and February 1st. He went to Khoo Teck Puat Hospital on February 6th. He was confirmed to have the virus 3 days later. But the People's Association said today that he was not in close contact with any of the performers or audience at Chingay. The other case is a 2-year-old Singaporean girl who was evacuated from Wuhan on the first Scoot flight on January 30th. She didn't have any symptoms when she boarded the flight back to Singapore. Of the 45 patients here, 7 have recovered, while 7 are in critical condition. Meanwhile, events that usually draw the overseas crowds have been badly hit by the coronavirus outbreak here. More than 70 participating companies have pulled out of the Singapore Air Show. The HSBC Women's World Championship, which features the world's top 20 female golfers, has also been cancelled. And earlier today, the Singapore Tourism Board said that the tourism industry will take a significant hit. STB revealed that the number of visitors is estimated to fall by between 25 to 30%. Multimedia journalist Renee Poh has more.
The warning signs are pretty clear. It's lunchtime here in Chinatown, and as you can see, the crowd around me is pretty sparse. At this point in time, STB said we are losing about 18 to 20,000 international visitor arrivals to Singapore every day. This visitor loss is steeper than the 19% decline in 2003, when Singapore endured the SARS outbreak.
Hence, we are preparing for a longer, slower recovery than SARS.
How badly tourist arrivals will decline depends on 3 main factors: how long the outbreak in China will last, what's the overall economic impact in Singapore and around the world, especially in China, and how long it will take for traveller demand to return. To ensure that the tourism industry makes a quick comeback once Singapore is free from the coronavirus, a Tourism Recovery Action Task Force will be formed.
I expect that the task force will focus first on confidence building. We spoke briefly about the need to get Singaporeans back out on the streets, visiting our attractions, staying in the hotels. There will be an element of reaching out to all our key international partners to amplify our marketing efforts, and obviously a major emphasis on international marketing as well.
Back in 2003, after Singapore recovered from SARS, the government did provide a $230 million relief package to help the industry recover. All eyes will now be on the upcoming Singapore budget on February 18th. The government has already hinted that given the economic fallout of the coronavirus, measures will be put in place to help businesses and Singaporeans. Renee Poh, The Straits Times.
Now, next, much is still not known about the coronavirus, said Executive Director of the National Centre for Infectious Diseases, Professor Liu Yi-sin. For instance, why some people get mildly ill, while others may die of it. Professor Leo also said some patients may be mildly sick for more than a week before the virus affects their lungs. Mild, non-specific symptoms include cough, sore throat, slight fever and fatigue. Several of those infected here who have no known links to China or other patients had seen a doctor 2 or 3 times before they were sent to hospital. But experts say Singapore's hot, humid climate is actually less conducive for the virus, as it thrives in cool, dry climates. Science and Environment correspondent Audrey Tan joins me now to go through some practical measures that each of us can do to fight the virus. Hi, Audrey. So, Audrey, you attended yesterday's press conference where infectious diseases experts were present. Now, on top of washing our hands and disinfecting surfaces, what else did these experts say we can do?
So yesterday's press conference was organized by A-STAR and some other research institutions in Singapore. So it was focused mainly on Singapore's R&D efforts on both the health and science fronts. But based on the available science, we can infer that there are some other tips that we can do. So the first thing would be, other than washing your hands and disinfecting surfaces, don't stay in enclosed rooms. Try to go outdoors, get some sunshine, try to turn off your air conditioner. These were some of the things that we can infer based on our available scientific knowledge.
Right. Well, Of course, as much as we can, we'll try to, keep in ventilated spaces, but that's not always possible, especially, like, for example, right here, we're in an enclosed space in the office, or when we take the bus, the train, the taxi, for example. So what measures can we take after being in an enclosed space?
So yes, you're right, and the experts have also noted that the use of air conditioning is unavoidable, especially in Singapore. But one thing that we know is that one thing we can infer based on present knowledge is that this virus is very similar to other viruses that cause respiratory diseases. And these viruses, as a whole, they tend to do better in cool, dry climates. So thankfully, in Singapore, we have hot tropical weather. It's kind of a natural a natural environment is not conducive for this environment to thrive. So after spending long hours in an air conditioned or enclosed room, maybe one thing that we can do is go out and get some sunshine, and where we can, try to avoid staying for long hours within an air conditioning room.
Right, that's good to know.
Yeah, yeah. So yeah, I see that you have an image of the virus on screen.
Right.
So all these things work because for a virus to be able to infect its host, it has to stay intact. So the various measures, whether it be washing your hands or exposing it to heat, it disrupts this structure. So for example, if this virus is out in the sun, the heat from the sun as well as ultraviolet rays can cause this membrane to tear. So as I said
Right.
earlier, the infectious diseases experts that I spoke to said that for a virus to actually be able to infect its host, it has to stay intact. So various measures, whether it's membrane tears or by washing our hands with soap and water and with disinfectant, it destroys these structures and makes the virus less intact. So once it's not intact, it renders it impotent.
I see. So Audrey, Duke NUS Medical School is working with the Coalition for Epidemic Preparedness Innovations to roll out a vaccine trial in Singapore, and that could happen as soon as 4 months. But what other forms of treatment are being explored?
So, in very broadly speaking, there are three main types of possible treatment strategies, which scientists call therapeutics. So, obviously, all of us would want a vaccine first because it's preventive, right? It can prevent the population itself from even getting infected with the virus in the first place. But for people who have already been infected, there are two possible types of treatments. One is called antiviral medication, and how it works is it basically targets the virus in the human body and prevents the virus from replicating. So you can think of it like the medicine is like a missile identifying the virus and like hitting it and rendering it unable to continue to infect other cells. Another strategy is known as monoclonal antibody therapy, which essentially involves a process that will help the body's own immune system fight the virus. So I'm working on a story on this, so yeah, stay tuned for that.
Oh, we will indeed. Thanks so much for your time, Audrey. That was Science and Environment correspondent Audrey Tan, and you can visit straitstimes.com for more on what infectious diseases experts said about the vaccine, as well as how to safeguard yourself against infection. Now, in the face of the outbreak, the Health Ministry's contact tracing teams work in 2 shifts, 7 days a week to find those who have had close contact with patients. Here's a look at the contact tracing process.
When Singapore confirmed its first coronavirus patient, the Ministry of Health activated its contact tracing team to identify individuals who have had close contact with coronavirus patients. But how is contact tracing done, and what are some of the challenges involved? Dr. Oliver Oh and Mr. Priyam Raj, who lead the contact tracing team, explain. When a coronavirus case is confirmed, the hospital will create a detailed map of the patient's movements and contacts 14 days prior to the onset of symptoms.
So once we have a confirmed case, we initiate this process called activity mapping. This is done by the hospital at which the patient is warded at. So the healthcare worker caring for the patient will interview the patient and basically get information on where he has been prior to the onset of symptoms, up to the point that he was admitted and isolated in the hospital. So this is a full movement history of the patient, all the places he has been to and the people that he had contact with.
The contact tracing team tries to verify the activity map, including with airlines and transport companies, and identify a list of close contacts who are those at risk of infection.
There's no hard and fast rule to define a close contact, so it depends on the length of exposure. For example, whether the person was wearing any personal protective equipment, and also the type of activity they were involved in. So we have to take all these things into consideration before we decide whether a person is a close contact. Assuming the patient was infectious during the flight, then we will actually obtain the flight manifest through the airlines, and we'll then identify persons who are seated within the certain vicinity of a case, 2 rows to the front, 2 rows to the back, and the row itself, so a total of 5 rows.
Callers then reach out to these close contacts and check if they are feeling unwell. Close contacts who are well will be served a notice of quarantine and given the choice of staying at home or going to a government quarantine facility for 14 days from their last contact with the patient. Those who have coronavirus symptoms are hospitalized in the isolation wards and tested for the virus.
For the contact tracers, currently we have activated 7 teams of 10. At any shift, we have 3 teams on duty. During peacetime, we have established a pool of contact tracers, and they have been given regular training on the contact tracing process.
I guess some of the challenges will probably be trying to locate individuals who are foreigners, because they don't necessarily stay at one location and may not have a working phone number, so trying to contact them and locate them can be quite challenging.
Another team analyzes the data from all patients to see if there are any overlaps, including the places they have visited or people they have met. Any linkages are flagged.
If the public does get a call from the MOH Contact Tracing Center informing them that they have been in contact with a case, we would like to advise them to be cooperative to provide as much details as they can.
Looking beyond Singapore, more than 1,000 people in China have died from the coronavirus, with Hubei province reporting 103 new fatalities. Now, Hubei's Health Commission also said there are over 2,000 new cases, and the total number of confirmed cases in China has climbed to more than 42,700. An advanced team from the World Health Organization is currently in China. Meanwhile, Japan has the second highest number of infections, including the passengers of the Princess Diamond cruise ship docked off Yokohama. 65 more cases have been detected on board, taking the number of confirmed cases on the ship to 135. Now, this coronavirus could become the next big pandemic. That's according to Pulitzer Prize-winning author Laurie Garrett. She speaks to our U.S. Bureau Chief Nomal Ghosh on Asian Insider on China's mounting problems and what it means for Chinese President Xi Jinping's relationship with his U.S. counterpart Donald Trump.
Right, so China has drawn praise for its swift response in identifying the virus very early, sharing its genomic sequence and all that. But otherwise, the political system, the same one that enables a hospital to be built in a matter of days, basically covered up the emergence for several crucial days. And we have the absolutely tragic case, of course, of the whistleblower, Li Wenliang, the doctor who was treating patients and was the first to notify that there was this new SARS-like virus, and he was put in jail and he got infected and he died last week. And this sparked wide anger on social media in China. You have spoken and written of the climate of fear in China, which leads to junior and mid-level officials not wanting to give their bosses bad news. And you were on the ground in China back in 2003. Is anything different this time around?
Unfortunately, there's a lot of differences and they're not good. The first is that, China's doing the Belt and Road Initiative, which means huge indebtedness as a nation, digging deep into their coffers in order to finance this massive infrastructure effort all over the world. That gives them less economic resilience than they actually had in 2003 against the loss of income from the shutdown of businesses, from the shutdown of trade, and so on. The second is this time, because of the Belt and Road, there's a greater risk of spread to countries that were spared from SARS. And in particular, of course, I'm very concerned about the Central Asian countries and Sub-Saharan African countries that are on the Belt and Road. The third big difference is that Xi is locked in a trade war with Trump. And this has really hurt their economy. It's brought a lot of things to dangerous points politically and economically. Doesn't help at all to have that in the background. The fourth thing is there is at the same time, there are 2 big animal epidemics going on. The African swine fever epidemic, which has wiped out about half of all the pigs in China, And then H5N1 influenza, the bird flu, has returned, which is incredibly lethal to birds. And we're seeing mass die-offs of domesticated chickens and ducks. Now, the reason that's significant is that here we are in an economic problem. We're putting people in lockdown, up to 100 million people in some form of a lockdown, greatly cut back on the movement of goods and services. Stores are emptying out of goods. What's the protein source as we go forward? What are people eating if chickens, ducks, and pigs are all being affected and eggs are in short supply? And then I think the fifth big difference between this and SARS is the politics in China today. Xi has consolidated the most power any leader in China has had since Mao Zedong. He has created an infrastructure throughout China that's quite different from what was in place with SARS. With SARS, as an outsider, our big confusion was, here's a guy sitting in the back of the room and he has some innocuous title. And here's a guy sitting in the front of the room and he's called the minister of something or other, or the mayor or the head of the local CDC or whatever, and you don't know which guy is actually more powerful. The guy sitting in the back of the room turns out to be the party official, and yes, he's more powerful. So in 2003, you had a kind of shadow government. You had the part of the government that was the party and the part of the government that was the official titled individuals. What Xi has done is consolidate them more so that really the government is the party and the party is the government. And what that means is that there's a lot at stake now for Xi and for the CCP in making this epidemic come to a quick resolution for economic reasons, for political power reasons, and for really kind of the existential state of mass support for the party.
Well, you can catch the full episode on ST's YouTube page. And those are our top stories for today. Find out the latest on the coronavirus at straitstimes.com. I'm Olivia Quay. Join us tomorrow for more stories on The Big Story.